Hey guys, welcome to tonight's live. I'm Dr. Tammy. I am trying to get situated here a little bit. I am in my hometown tonight and doing this live from a little bit different location. So I'm a little bit out of sorts here. So there we go. Let's try that. And I think that might have just thrown my live stream off just a little bit, but we are on TikTok. So we are living the dream here. And I'll move that around just a little bit, and I have a little bit of a head cold. So please forgive me. I do take all my supplements. I don't know how this hit. Things are a little crazy, and we had some severe weather changes. So if I sound a little nasally, I'm sorry about that. And so we are here in a wonderful VRBO, and it's a really cool place. And I got to see the house I grew up in today and all around town. And I haven't been back home in a long time. So it's super, super nice. And so here we are. I don't know if this is our last night here or not. Let's pray that it's not, because this has been such a good platform for me and for all of my tribe. And I've just really enjoyed being here. And there's nothing quite like it as far as how much I get to all of you. Hi guys. Hi Constantina. So it would be very sad, but I am on Instagram, and we just checked that earlier. Instagram Live is a thing. And I am on Facebook as Dr. Tammy, so you can find me there. Thank you, honey. And let's see what else. YouTube. So I haven't played much with YouTube Live, but I have tons of YouTube videos. I've been on YouTube for years and years and years. So you can find me there. The cool thing about YouTube is that all of my videos, I'm under Dr. Tammy Tucker, all of my videos like from like 7 years ago are on there. So you can go see like the old nerdy me and the new nerdy me. So they're all there. So yeah, go find me there. Hi, Ann. So, if anything happens and you want to find me, if you go to my main page with all my videos on TikTok and you go to the link in bio and you press on that, it'll take you to a link tree. Hi, Christy. Hi, Dream Big. I'm not sure what your name is, Steph. If you go to the link in bio, it has a lot of free downloads, information on hormones and liver and genetics and just all the things. So you can go and get some free information. And I try to make it really interesting and cool so that you can have some real applicable takeaways as well. So go do that. And that way, when you download those, we will have your email. I always promise not to spam you or sell your email. So it's safe, but I will let you know when I have more information or when there's new things for you to know or how to find me. So, anyway, again, we will just pray that I will stay here. I have been doing these lives at 7 o'clock every night. I think almost, hi Tacoma. I've been here almost, I don't know, gosh, how long you guys been following me? Over probably almost 2 months now. And I always say, as long as you keep showing up, I will too. So hopefully this platform will keep showing up too. So even when I'm sick, I'm still here. It's just because I love you guys and I really want to. Oh, 2 months. Okay, Constantina, our 2 month anniversary, maybe even. So yeah, I'm pretty new to TikTok. It's kind of crazy because I had an account for a long time, but there was like I had 2 videos and I think they were cat videos or something. So when someone said you really need to go to TikTok, I was like, okay, I'll do that. I'll try it because they're like you can get a really big audience there, and that's what I want is a big audience, not because I think I'm cute or anything, but because this information is not only life changing, but it's life saving. And we have a lot of women suffering, and that has to stop. And that stops with a really large group of us. We have to be really big and really loud, and we have to say, stop the madness, and we need to dispel some myths. So yesterday I did all things breast, and I have not quite, I have it downloaded, I haven't re-uploaded it and posted it just yet, but that should be out tonight. And then I'll have this one tonight up tomorrow. And then they are all on Facebook as well and on YouTube. So you can always go watch them there. So, all things breast, we were talking about hormones, breast, risk factors, family history, cancer risk, all the things. And tonight we're going to talk about the uterus because during last night's talk, you guys asked about fibroids, endometriosis, what they are, what we can do. And so, per your requests, we're doing all things uterus. I can't see where I'm pointing because it's like the mirror's flip screen. So anyway, okay, let's get into it. Uterine embolism on 12 centimeter fibroid in September. Okay, so we'll talk about that for sure, for sure. I'm going to show what that is. So in case they just did that to you and didn't explain it, like informed consent, right? That is so important. They just say, you need this thing and this will fix this thing. And then they take your uterus out and they're like, this is going to fix all your problems. And they don't tell you the risks and the benefits. Well, actually, you sign off on that as you're being, kind of taken into surgery kind of thing. But, they don't tell you what all your options are. So, follow up in March. Okay, so I'm going to explain, and I'm going to probably be wiping my nose a lot. Sorry. I'm going to explain all things uterus, and hopefully by the end of this, you will really understand. Yeah, I do have a little cold. What age should you take HRT? So I'm going to go ahead and answer that right out of the gate. I'm going to say whenever you have symptoms. So, and we are starting bioidentical hormone, I mean organic hormones, as soon as you're having symptoms, because if you have endometriosis or PCOS, ovarian dysfunction, any of those things are time to start regulating your hormones with natural hormones. So if like your thyroid wasn't working, then you would go on some thyroid hormone, right? So it doesn't mean you don't use thyroid hormone if you still have a thyroid. So if you still have ovaries, but they're not working or they're having issues, you can still use bioidentical hormones and smooth that over. You don't have to have all the drugs that they want to put you on. You don't have to suffer, and you don't have to start having these things removed, these body parts removed, because that's just the easiest thing and the most financially advantageous to the people who do that sort of thing. And again, I'm not saying don't do those things and don't listen to your doctor. I'm just saying I'm going to share some education and some information, and you can decide for yourself. Here's the other thing too, is my medical disclaimer is that, again, this is all just informational stuff and I want you to have your power. But again, don't mess around with stuff. If you're having heavy bleeding, if you're having symptoms, absolutely go to your doctor and get checked out. Always, always, always. And just because I tell you there are some options and things, I just want to kind of put that in your sandbox so that you understand. Okay. So, first of all, I just want to say I have a little visual here. What is normal bleeding? Because everything around this is really based on issues with bleeding, usually, because that's what the uterus does. But the uterus is beautiful and wonderful, and it makes us females, it makes us have the ability to literally transfer life out of us into society. So, we are the bearer of life. It's absolutely a beautiful thing. But when it goes awry for lots of different reasons, whether it's in our environment, whether it's chemicals, whether it's things we eat or genetics, there's so many different components. We have to be able to understand it and take our power back. Or otherwise, sometimes these surgeries, these hysterectomies, all these things, they are not without risk. And if you can fix it in an easy, natural way that not only fixes the uterine bleeding, which is what is usually the cause of most hysterectomies, if you can fix that, why wouldn't you want to? Because I always say removing the uterus does not fix the hormone imbalances. So why wouldn't you want to fix the hormone imbalances? Okay, so let's talk about what normal bleeding is. Normal bleeding is 3 to 5 days. I always say, our cats and dogs, when they still are fertile and they're having periods, you hardly even know that they're having a period. I mean, it's just like almost like spotting. So, this is a teaspoon. You should not have any more than 3 teaspoons over the course of 3 days. So, how does that sound? We should not have a whole aisle in the store of Super Plus tampons, because you would not need a Super Plus tampon for a tablespoon of blood over 3 days. Okay. Or 3 tablespoons of blood over 3 days. Okay. So that's not insignificant, right? That could be just over time. It's a little more, I always say, than light spotting, but it's a little more than light spotting, but it shouldn't be like a cup full every 4 hours. And that's what we see a lot with some of these dysfunctional things. So I want to go over, before we jump into anatomy, I want to go over just a few things. And number one are the myths. So it's interesting because the history is important, because what we've gotten into is this idea that we are broken because this is a thing. And it's interesting. I've decided to go back through and start reading Genesis, and it's just fascinating to me because in the beginning of Genesis, and this isn't a religious talk, I promise, but in the beginning of Genesis, it actually talks about this sort of thing that because Adam and Eve messed up, that now childbirth has to be painful, and that we're sort of cursed with this process. And so we kind of bring into that this sort of thought that we're broken or we did something wrong. And I kind of wonder if that's where some of the shame is attached to this painful childbirth. And so we kind of get into this place where we think that menstruation is dirty, or that menstrual blood is a bad kind of blood. And really, it is just the same blood that you bleed if you cut yourself. It does have some uterine tissue in it and some mucus, but it's the same blood. I started HRT a month ago and it brought my period back. Okay, well, that means that it's not the right dose for you, but that doesn't mean that it's bad, right? But you shouldn't be having periods, because sometimes women will say, well, it's okay. If I feel better, I don't mind having periods. But if it's done right, you shouldn't be having periods. And especially if you're having symptoms, then that means that it's not right for you. If you're still tired, if you're still not sleeping, if you still feel like you're aging like literally 20 years overnight every night, period lasts only 2 days. Yeah, so that's a good thing. As long as you're not having a lot of other symptoms, as long as they're short. So a normal period can be anywhere from 3 to 5 days, sometimes 7. That doesn't mean it's abnormal. You can have some stress or something else going on. Anywhere from 28 to 35 days is normal. And we just use 28 because it's an easy to remember cutoff day. And your cycle should come about every so many days. Perimenopause marks when those start getting irregular. And I highly recommend that you start bioidentical. Hi, Carol. I highly recommend that you start bioidentical hormones as soon as those periods start getting erratic, because we sort of learn to suppress things, and we stop thinking that, this is like something we could do about it, because we're scared of hormones and we don't realize there's something you can do about it. Period times year for 5 to 7 days, once a year. And I'm not sure what you meant, Heidi, but sometimes you can have some periods even after 1 year without periods, which is what menopause is technically called. So a lot of things that we're going to talk about is after menopause, we call it ovarian failure. And literally the ovaries, you cannot see them on an ultrasound within 5 to 10 years after the last period that you have, because they literally dry up. We're going to talk about that. But mostly what we're going to talk about is women who still have ovarian function, because it's really hard to talk much about the uterus if you don't have ovaries still. I'm period every year for the last 3 years. Okay, so that's pretty sporadic. That tells me definitely that something in the feedback loop with the hormones is wrong. She said only 1 period every year for the last 3 years. So definitely some sort of perimenopause or ovarian dysfunction or failure going on for sure. Okay, so some things that you might think about are what the process is with the inflammation that's going on. So, and the historical perspective is there are different cultures that look at menstruation differently, and it forms our experiences too. So some people celebrate childbirth, and some people sort of stigmatize it in that you got to go to the hospital. And I'm not telling you not to go to the hospital for childbirth, but we've medicalized childbirth. We've medicalized just about everything. We have attached medications to all these processes. And so instead of talking about natural herbal supplements, or I'm so sorry, my nose is like just crazy tonight, just a little head cold. I'm okay, I promise. I always wondered what I would do once I've started this commitment to these lives if I got sick or something. I'm like, dang it, I'm going to push right through it. So I'm okay, I promise. Okay. And then the uterus is a powerhouse, and it's not a source of discomfort. You shouldn't hurt when you have periods. So that's another thing about if you know that something's wrong, because it can be uncomfortable and you can have some light cramps. But if you're having to sit on a heating pad at work or against your back and you're taking ibuprofen every 4 hours, That's not normal. And I always say it's easy to cut out your uterus, but that doesn't fix the problem. So I think there's this thought that we should look more at the uterus as it's, yes, there's some pain associated with it and childbirth. Sickness. Oh no, Elaine, I'm good. I promise. I promise. Yes, no, I've been resting all day and just visiting with family and stuff. So I'm totally cool. I promise. But that's sweet of you to be concerned. What about high pressure before periods? Is that something to be worried about? High blood pressure? Absolutely, because estrogen imbalance can, because it actually regulates the elasticity of the blood vessels, that can be a problem too. What to do if it's so painful? Okay, Maria, I'm going to tell you what to do, and I'll just cut to the chase in case you can't stay the whole time tonight. And that's natural progesterone, so bioidentical progesterone. Pretty much the solution to all of this, of course, you know me with bioidentical hormones, is going to be anything to balance out irregular estrogen production. So I'm going to walk you through all of those. Only had a period a year for 4 years. Oh, wow. So definitely you've had some ovarian dysfunction. She said she's only had a period once a year for 40 years. So that's been going on a while. So we can fix that. Sure. Yeah, we got it. Okay. So let's see. Oh, also, I think here's a little philosophical stuff, and I want to make sure that I get all through all the nerdy science. And that is that there's this pack mentality, and that is that women, because we have babies in the wild, like animals, like lions and things like that. There's a great book I read once called The Female Brain, and it talks about some of the chemistry and the brain chemistry and how we bond, and we're in tribes. So you guys and we're in a tribe, right? And there's a lot of support in that. And I think that women really need more support as we're going through these things, because it's our survival, right? The support and somebody to say, you're not crazy. I understand there's a solution, and you just want to feel at peace with all of this. And so you're, at home going, I have a period a year for the past 40 years, and then you're like, is that normal? And so nobody's talking about it. Factor 5 question. Is that the factor 5 laden, like a bleeding disorder? I'm not sure what you're saying, but actually, if that is factor 5 laden blood clotting, I'm actually going to talk about that tonight too. So that's really interesting. You brought that up. What is the fact? So yeah, so this whole thing, like, have you heard that women menstruating, like living in a dormitory, or women at work start to cycle together? I think it's really interesting because the lunar cycle, the moon cycle, actually we do cycle. So does the moon every month, right? So we are meant to cycle. We are meant to have this balance thing. And so I think it's interesting because I looked that up because I've always heard that. Oh, thank you, Constantina. Basically, that it's our environment, it's our stress environment, and there's something called pheromones, which are kind of like hormones, but they're thought more of like more of an odor that you put off. But pheromones can actually shift the hormone balance. And so if you're around somebody and those pheromones are around, it's kind of, sometimes it can be what makes sexual attraction. Some people have, did she answer it? I'm not sure if I answered the question. So if you put it back through, I'm not sure I had that right. But anyway, so yeah, attractants, pheromones, like when you're attracted to the opposite sex kind of thing. But that is a chemical that you put off that could shift some of that stuff. And there's actually some research studies on that as well. So, okay, so I'm going to get right into it. We're going to get into some nerdy science. We're going to talk about the uterus. Okay, so this is cool because I love nerdy science. And I think that it will really help you understand things. Okay. So this is a uterus. I drew this myself. Okay. So what we have here is we have the blood vessel coming off of your heart up here called the aorta. So this red is blood vessels coming down, and this is the uterus here. This is the cervix and the vagina, and these are your ovaries, and these are the fallopian tubes. And within the uterus, this is like a cross section, like you just took someone and you like sliced them in half and you're looking at the uterus. And the ovary is very interesting in its relationship to the uterus. So I know this is all things uterus, but we have to talk about the ovaries just a little bit because they are relevant, okay? So inside the ovary, and I don't have the ovary filled out here in case I wanted to put something in there. Inside the ovary is these little dots, which are microscopic eggs. There's a feedback hormone from the brain that then tells the ovary to start developing its eggs, and it starts to grow in a follicle. This is an axis here, a graph of 1 to 28 days, which is the menstrual cycle. And day 14 is the day you ovulate. And so this is what we call the follicular phase. So in this phase, you're actually making a follicle and it starts to develop. And when it starts to develop, then what it does is it literally ruptures. The fallopian tube has these crazy little, they're called fillet, and it looks like a little broom or a brush, and it has suction in it. And so they sort of wave like flagella. They kind of wave and they suck up the egg once it breaks out. And then the egg travels up the fallopian tube. So this is interesting because if someone has intercourse and a sperm enters into the vagina, then the sperm then gets pushed up into the cervix and it travels up in the uterus, and there's contractions that happen, which is a lot of times the benefit of an orgasm, and because it actually contracts the uterus, pushes the sperm up into here, goes up into the tubes, and then gets fertilized somewhere about here. So the sperm meets the egg, which popped out of the follicle, and then goes down into here. And then that goes into the uterus. The fertilized egg goes into the uterus and then implants here. So why am I telling you about babies? I'm telling you about babies because when you look at 28 days of the menstrual cycle, estrogen is driving this first part of the cycle, and then progesterone kicks in from a feedback hormone from the brain up here and tells that estrogen to calm down. And if you do get pregnant, now progesterone starts being made from the uterus itself, and it stands for progestation. So it promotes the pregnancy and it makes the lining where it's very, very friendly for the baby to live. And everything about the uterus is designed to make a baby. We think it's just like this thing that's a nuisance and we have a period every month. All of this process is designed to make a baby. We live to make babies. Disa, yeah, I do have Instagram. It's I think it's under Tammy Tucker, but yeah, I do, absolutely. Okay, it's designed to make babies. But when we're done making babies and our ovaries run out of eggs, now the uterus starts to dry up and the ovaries literally have no function anymore and they go away. They just literally dry up because you're born with all the eggs that you're ever going to have. And it's very interesting because a lot of the conditions that can happen regarding dysfunctional uterine bleeding are all very important that you understand the different components, okay? So this is a ligament that holds this ovary structure out, and then you have the blood vessels that come down, and these are blood vessels that feed the uterus called the uterine arteries, and then these arteries go down into here. So somebody mentioned a while ago a uterine artery ablation for bleeding. So if you're bleeding a lot and the blood is feeding this uterus and you need to, so it's like, it's a Band-Aid. Yeah, I will be on Instagram for sure. It's a Band-Aid when you go up in here with a catheter and then they put plastic in there. Like I think of it like the little plastic, the little balls that like are on beads and stuff. So literally they put tiny little microscopic pieces of plastic in here and they embolize. That's called a uterine ablation, or not, that's embolization, uterine artery embolization. And so that's what that process is. Somebody mentioned that. Okay, so let's get into the different uterine problems that you can have. So heavy bleeding. So 3 out of 10 women have heavy uterine bleeding. Is a copper IUD a bad thing? The copper IUD, we'll talk about family planning here in just a minute, and I'll actually talk about the copper IUD. I do actually recommend the copper IUD because it doesn't secrete the synthetic progestins or synthetic progesterone. So yes, it's good for family planning, especially if you're having problems with this whole process because, one thing that we do is when we can fix this with bioidentical hormones, we can also increase your fertility, which I have a whole natural fertility program with all of this understanding as well. So, okay. So, endometriosis. 1 out of 10 women have endometriosis. This is huge. These are huge numbers. And you know it because you hear it all the time. Yeah, it was heavy before I was ablated. Yeah. And so an ablation is actually, a uterine ablation is where they come up in here and they can either put a big water balloon in here that's heated and cook the inside of the uterus, or they can come in here with radio frequency and they blast all the sides, or they can go in there with a laser and blast the sides, because this is inside the uterus. This is a cross section. So this is the muscle. And this is like if you opened up and you kind of cut through there and you're looking inside a cavity. And so what happens is this becomes thickened. So when you talk about problems with the muscle here or problems with the bleeding, when this is out of balance, it's the hormones that are causing it. And this is why I say a hysterectomy, taking this out, does not fix the hormone problems, because the hormones are what are regulating the tissues, regulating the eggs, regulating all of this. So a total hysterectomy is when you have everything cut out. And a partial hysterectomy is when you just take this out. And whether they take the cervix or not, a partial hysterectomy is just the uterus. A total is when they take everything. And so, like we talk about PCOS or ovarian dysfunction, I know this looks like a bunch of cysts in here. This is just this series of that, then you're looking at that, then you're looking at that. So this is the development of the egg and how it pops. If that egg were to pop over here and that cyst fluid goes out here to the pelvic cavity, that's when people can have symptoms of a cyst rupture, and that can trigger a lot of inflammation, which can then cause bleeding. There's also something called, with endometriosis, that is lining of the uterus in here that is outside in the pelvic cavity out here. And if you look at the ovaries, the way the egg pops out, and then these little suction cups, these little hairs on here, like a little vacuum, sucks the egg up into the fallopian tube. If you have a lot of blood in here, and the blood is so much that it's literally filling the fallopian tube, then the blood can actually, they call it retrograde menstruation. And now all of this blood that's in the uterus can then exit out. And then you have blood that's outside the uterine cavity, and blood out there hurts. And so every time, and then these little endometrial cells that traveled up through the blood, now they're implanted in the pelvic wall. And every time you have a period, especially if your hormones are out of balance and you have too much estrogen, this estrogen is this red line, and too much estrogen, these endometrial cells that have been planted out in the pelvic cavity can inflame, and they're very irritating, and it causes extreme pain for people. And some people have a lot of those endometrial cells out there, and some people just have a few. But it is very painful to people that have endometriosis. So endo means inside, and metrio means this muscle, or the myometrium. This is the muscle inside the uterus. And the endometrium is this lining here, and that's what fills up with blood when you have a period. So in this part of the menstrual cycle, when estrogen starts to peak right before here, and this is where you get your PMS or your PMDD, this is where you have a lot of estrogen and you have a lot of blood that starts to fill the uterine lining. And it's kind of like one of those water parks. I love this analogy because it's like, in the water parks, when the bucket fills up with water, it's only supposed to fill up just a little bit, and then it dumps, and then it's a nice little shower. If that bucket fills up too much, it literally is like dumping on your head, and it's extremely painful. So if estrogen, or what we call estrogen dominance, starts to do this number, now you have what's called estrogen dominance. This lining fills up, It can retrograde and spill back out in the peritoneal cavity. And then you have a lot of excess bleeding. And so that's where the dysfunctional uterine bleeding comes from. So what causes that? There's lots of different things. There's an imbalance in estrogen to progesterone. There is environmental factors. There are endocrine disruptors in our food supply, chemicals, PCBs in our plastic. There's so many chemicals that are illegal in other countries that we're being exposed to now. So we have more and more and more of this happening. Okay, so heavy bleeding, we good with that? Okay. Endometriosis, you guys good with that? Good on endometriosis? Understand that? Okay. So for endometriosis, now heavy bleeding, they'll just let that go on and on and on until you get extremely anemic and start bleeding out and passing out. And so tired you can't hardly stand up. At some point, they'll usually offer to take your uterus out if your iron levels like drop down in the 20s or something like that. Endometriosis, again, is when this uterine endometrial cells are out here in the pelvic cavity. There's a couple different ways they treat this. Instead of using bioidentical hormones and using progesterone, natural progesterone to calm this peak down, right here, days 11 through 21, that's how you fix it, bioidentical progesterone. Instead of doing that, they offer you the uterine artery embolization. So if blood can't get into the uterus, you won't bleed, right? That's one way to do it. I mean, who thinks up this stuff, right? But what about if those little plastic bits break off and go back up into your brain, which is actually when you do your informed consent, that's actually one of the things that they tell you can happen. I'm not trying to scare you because I know one of you just had that, but that's one of the things they do. And again, the ablation, which this is embolization, this is an ablation. This is where they put the big hot water balloon in here and just melt it and fry the uterine lining so it can't do what it does anymore and fill up with blood, or they laser the walls or something like that. And they can also use freezing, so they can do cryo to freeze that as well. Okay, good with that? I'm going to move on to fibroids. Good? Fibroids. Okay. Fibroids. 70 to 80% of women over the age of 50 have fibroids. Any natural tips for endometriosis? Yes, absolutely. Natural progesterone, days 11 through 21, or if you have endometriosis, which is rare after menopause, because the ovaries shut down and they're not making hormones anymore, so all of this just shrivels up and goes away essentially. But natural things for endometriosis, yeah, frozen. Natural things for endometriosis would be to use progesterone, bioidentical progesterone, to balance that out. And then I do have some supplements I'm going to talk about. There's not enough supplements in the world to balance your hormones out when they're this bad that you have this disease process going on. But things like fish oil, vitamin D, maca root, there's a lot of things. So I'll talk about those on the other side. So let's see, what are we? Fibroids. Okay, so fibroids are muscle tumors. So this is all muscle. Myo means muscle. Metrium means this layer. And this is just a big muscle right here. So I'm going to just do some blue here. And this is all just muscle fiber here. Okay, muscle fiber, muscle fiber. And take some of this blood out of here so we don't have to think about all that heavy bleeding in there. And so this muscle fiber, what happens is, because it's so overworked and it's contracting all the time and there's so much blood in there and it's really being overworked all the time, it starts to develop muscle, right? But it doesn't really need muscle. It needs to just have one nice smooth muscle. But it's like your uterine lining has been to the gym. And if you've ever had fibroids, it feels like you worked out really hard at the gym and it's really tender and painful, only it's like that all the time. It's not just like the days you overworked in the gym. It's like constantly, because what's happening is it's not just happening during your cycle. Now it's worse because when this fills up with blood, it puts pressure on that myometrium. And so it is worse, but usually fibroids hurt all the time. And I have women tell me, that I'm scared because I had endometriosis. I had a lot of blood. I had heavy bleeding. I have fibroids. And they're telling me that I can't take hormones because it'll make it worse. And that might be true if you take synthetic hormones or you get the wrong balance of hormones. It has to be balanced. But that doesn't mean that you can't take bioidentical hormones because they're the same hormones that your body makes. And it's the same balance, but you have to get it right. Disa, I have fibroids and myomectomy, then fibroids came back. Yeah, because you can take these masses, these overworked muscle tumors, they basically make tumors, kind of like a bicep, how it gets big, like these tumors. You can go in there surgically and you can take them out, but they're just gonna, like, once this all happens again, they're just gonna come back. So you can have a myomectomy, meaning ectomy, like hysterectomy, and have it removed. But most likely, if you don't fix the hormone problem, they're just going to come back. And so these fibroids are just within this wall. And once you cut that part out of the wall, now you're losing part of this and they're just going to move somewhere else or up in here. I actually did a pathology internship for a year, and we would get these uteruses on the surgical bench and we had to cut them open. And these fibroids really just looked like these round circular things that just looked, it's just kind of weird, like a bunch of muscle fibers in a circle. So that's what they look like, kind of crazy. It was cool to be able to see that because like most people don't ever get to see that stuff. So that's like, was really kind of interesting. Okay. Fibroids. Understand fibroids? Yeah? Okay. So polyps. What's a polyp? A polyp is just an outpouching, so like a diverticuli or in your intestines or your colon. This is, let's say this is a normal intestine, and then this is a polyp. It's just a pocket. So you can literally get a pocket of endometrial tissue there. And they can cause all sorts of irregular bleeding and problems as well. So when you hear uterine polyp, that's what we're talking about. Adenomyosis. If you've ever heard of adenomyosis, that basically means that in this lining right here, you have increased sensitivity, sort of hyperplasia in this inner part of the muscle wall. And this is more sensitive to estrogen receptors. And so it's more likely to bleed. So the actual lining itself is more likely to bleed. Heavy bleeding. Yep. Adenomyosis. Okay. So that's really what happens there. And I will mention with endometriosis, the only way to identify endometriosis is with a laparoscope, meaning surgically looking around in here to see if there's uterine tissue, because you can't see it on an ultrasound. Use biopsy after hysterectomy in early 50s. Absolutely, you can. And I'm going to talk about why people are scared, like, to be on hormones more than a couple years, like hormone therapy, or the age of onset. So I'm going to talk about that in just a minute. Okay, so adenomyosis. Hyperplasia just means a thickening of this wall. And if you go get an ultrasound, they can do an ultrasound by actually sticking a ultrasound wand up into here and looking around. And they can also do a pelvic ultrasound, which they just look all over everything. And okay, let's talk about cancer. About 60,000 cases of uterine cancer are in the US. And most of these women are over the age of 60 because they don't have the protective effects of bioidentical hormones. Adeno, hysterectomy at 44. Yeah. So that didn't fix the endometriosis and the adenomyosis. That didn't fix that problem just by taking the uterus out. It didn't fix the hormone problems, because if they left ovaries, now we still have to work around the problem here. Or if you have it all taken out, now we have those hormone issues. Sorry. I'm so sorry. My head cold is kind of good. Oh, I guess. Okay. I know it's going to make it through tonight. I'm so sorry. If you've just tuned in, I have a little bit of a cold. So ovaries failed within a year. Yeah. And a lot of times, if you, thank you, Elaine. A lot of times, if you do have all this dysfunction going on, the ovaries will just give up the ghost because they're like, I am so freaking tired. Are you kidding me? This is a mess. and this is what you are really making me deal with all this. Forget it, I'm out. So that is one of the biggest problems that can happen as well. Okay, so cancer. What is cancer? Well, these fibroids, these muscle tumors, basically, if you keep overworking this muscle wall over time, that cell hyperplasia, I mean, they're just changing and growing. And what is cancer? Cancer is just cells that keep growing. And then the bad cells that are dysfunctional don't die. I mean, they're just like zombies, like around going, and like nobody's telling the zombie cells to die. Suggesting copper IUD. Yeah, so copper IUD, people ask me a lot what a IUD is. So a copper IUD is just a little bit of copper wire, and it gets inserted up into the vagina, up through the cervix, and it's in a little tube. And then when you pull the tube down, the two ends just pop out like this. So it looks like a T. So it looks like a T, like that. And it irritates the lining so that the sperm, when it comes in, can't implant, and or the sperm can't really get through because it's kind of inflamed. And then when this comes down, it's not where it would want to implant in these uterine walls. Now, some of them, like the Mirena, are the ones that have synthetic progestins, which is not a bioidentical progesterone. It's a progestin, totally different chemical. It will emit that, and it will actually upregulate the progesterone receptors in here, which can increase your risk of cancer. So I know I didn't say that, but it is a thing. And we just talked about breasts last night. And when you have synthetic progestins in your body, which is in the WHI study in 2002, it was the progestin arm, not the estrogen arm. It was the progestin arm that was causing the cancer, because it was the genetic susceptibility to those progesterone receptors was being activated. So as CT, and they said I had endometrium thickening. Would I need to do anything? So yeah, bioidentical progesterone, not progesterones, but bioidentical progesterone would absolutely calm this estrogen down and this thickening, so that you go back to this. We'll take the IUD out. And this is the uterine wall now. So bioidentical progesterone during the mid part of your cycle calms all of that down, and it makes the ovaries behave. You don't have that overflow, retrograde menstruation, the endometriosis, all that calms down. Cancer, it's just overactivation of these cells in here, and over time that can absolutely become a thing when the cells are overworked. Also taking synthetic progestins, which are found in birth control, which are very high dose. And what it does is high dose progestins and high dose synthetic estrogens, which are what birth control are, they actually keep the cervix where it can't implant. It actually shuts down ovulation with a feedback hormone from the brain. I'm going to say the brain's up here. Shuts down the feedback hormones there. And so that's putting you into a semi-state of menopause. That's why it helps with periods, because it shuts down everything. But it also has a couple other scary things that it does. So I'm going to share that with you on the other side. Okay, and hysterectomies, there are about 600,000 hysterectomies in the US a year. And that is their answer to this. Let's just take it out. I always say this is not a placeholder. When you take this out, you know what you also take out? These ligaments that hold your bladder, because your bladder sits right here, to the sides. If you don't have a uterus, what happens? All that can fall out right through the vagina. So that is prolapse. Uterine prolapse. If you still have a uterus and you don't have estrogen affected, so now all that's sort of falling, but now you can have bladder prolapse because you don't have this to hold everything up in there. They can put something called a pessary within the vagina that holds things up, but ew, that's like a big old, like, I think of like the cubes that you like, put the chalk on your pool cues. Hi, Valbona. Hi, Sherry's there. Hello. So yeah, then there's something called pelvic inflammatory disease, which are things like infections, like HPV or syphilis, some of the more rare things, although not too rare anymore. but pelvic inflammatory disease can be set off by infections, and then ovarian dysfunction. So I want to talk a little bit about progesterone, since we're here with progesterone, calming the effects of estrogen down to prevent this estrogen dominance. Progesterone's function, this green line here, is to decrease inflammation, and it inhibits the pro-inflammatory cytokines. So cytokines are chemicals that go and increase inflammation in here. So progesterone actually blocks through the bloodstream these inflammatory cytokines. So you have cytokines that make inflammation, and you have these chemicals that block inflammation. So progesterone makes the ones that block inflammation. Receptor activation. So progesterone actually helps calm down how many progesterone receptors you have, which also plays over into breast cancer too, which is this talk I did last night. This receptor activation actually happens in the brain and the uterus. So that's the reason why you're not crazy when all this is going on. Those progesterone receptors in the brain, when you have progesterone deficiency, because that's what's happening when you have estrogen dominance, makes your mood go crazy. So you're having heavy bleeding, you're losing your mind, everybody in the house hates you, you're irritable, you're sad, you're crying, and then you're laughing, and then you're sad, and then you're crying, because those receptors in the brain are all off. It's not just in the uterus. There's a term they use called hysterical, which comes from the word hysterectomy, or hyster meaning uterus. Progesterone promotes tissue healing, because once the blood comes out, all of this is raw. So you want progesterone in there to actually heal that lining so it's not painful in there still. And progesterone calms the nerves, because you have nerves that are feeding the uterus. That's how you feel the contractions. Nerves also feed this whole area, but you have to have the nerves to make the muscles contract. And progesterone calms that nerve inflammation and that systemic nervous inflammation. So, okay, so I'm going to flip this over. I have a little bit more there. Yay, more. Okay, and I know I'm about 15 minutes out, so I want to, I'll hurry through this just a little bit. I'll try not to rush too much. Try not to sneeze too much either. Okay, so, and I do want to say kind of halfway through, because I know some of you have to come and go. If you want to look at bioidentical hormones and get tested, because most doctors will give you so much crap about even testing your hormones, which is crazy, because if you didn't have a thyroid, they wouldn't tell you couldn't take thyroid hormone, and they certainly wouldn't just put you on a random dose without testing. So if you want to get your hormones checked, go to hormonebliss.com or go to my link in bio, and you can order after hysterectomy. Yeah, so you definitely want to do both after hysterectomy, because they'll tell you, remember when I drew the uterus, they'll tell you that if you don't have a uterus, you don't need progesterone for all the reasons I just said, but that's like saying you have shoes, you don't need socks. Remember, progesterone did all those other things to decrease inflammation and to balance out the estrogen. I didn't realize all could fall out. Yeah, so that's case in point. She's saying she's scheduled for a hysterectomy, but she didn't realize that everything could fall out, right? So like, yeah, for sure. I mean, that's one of the things they don't tell you. Or they use the medical term, like you could have bladder prolapse, which means your bladder could fall out of your pelvic cavity, your vaginal vault. I mean, it's like, yeah, and they might just skim over it, or it's one of those things that the nurse talks you through and says, oh, you have this and this and this. And it's like those commercials, those drug commercials you watch at night when you're watching TV, and they're like, they whisper, could cause fecal incontinence, could cause headaches, could cause all the way to blood clots to death, you know, and then you're like, and you think that's the only option because that's what doctors tell you need, which I'm going to talk, more dollars, which I'm going to talk about the difference between bioidenticals and natural. So a synthetic progestin is very different from a natural progesterone. And I always use the analogy, it's like the difference between a strawberry and a strawberry candy. Natural progesterone is like a strawberry. Your body knows what to do with that. Synthetic progesterone is like a strawberry candy. If you eat too much of that, you can get diabetes, right? Completely different structure, acts very different. And so when we're talking about family planning, because people are like, well, okay, if I can't take these synthetic hormones or birth control to calm all this down, what am I going to do? And as people are making their decisions, it's kind of like, why don't we seek help? Well, we're afraid of hysterical, right? We're afraid they're going to think that we're crazy. We're afraid that they're just going to do these medications and cut our uterus out. We're afraid that we're being selfish because it takes time off to go have a hysterectomy and you're away from work and away from your family. And we're afraid of feeling stupid. What if we go in there and they tell us, oh, you're fine, come back when you're blah, 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 So the difference between birth control, which is synthetic hormones, is the difference between a strawberry and a strawberry candy. But I do want to talk about family planning because this does play in. So synthetic hormones suppress your ovulation, meaning that egg popping out of the ovary. It thickens your cervical mucus. So here's the ovary, here's the uterus, and it suppresses ovulation. So the ovary is really not functioning anymore. It thickens the cervical lining, so it makes this really thick, so the blood can't fill up there. And then it also makes this cervical mucus really thick, so that sperm can't, like swimming through mud. It can't get up in there. So synthetic progestins do all that and thin the uterine lining, so the uterus is thin, and now it just kind of bleeds out. So that's why you don't have heavy periods. Then there's also the Plan B, which just delays your ovulation. It keeps the eggs from popping out. And then there's hormonal IUDs, and we talked about that a little bit. One of the things with synthetic estrogen or progesterone is that it actually, when you swallow a pill, and sometimes there's patches and other things, but it goes through the liver in something called first pass metabolism. And the thyroid also competes because it has to convert into its active thyroid. So that's where the weight gain comes in, and also can suppress your natural GLPs, which are your hormones that make you feel full and actually can slow your gastric emptying, like the weight loss shots like Ozempic, that kind of stuff. So then you gain weight. And why do they use synthetic stuff? Let me talk about non-hormonal birth control is ovulation tracking, tubals or vasectomies, and the copper IUD. So why don't we use bioidentical hormones? Because the amount that you have to use in the high doses haven't been studied for natural bioidentical hormones for that purpose. So I always say, I don't want to take on raising your baby if you get pregnant. And because natural progesterone actually increases fertility because it calms all of those dysfunctional problems in the uterus down. So synthetic progestins have a longer half-life, so they stick around longer. They have a higher affinity for progesterone receptors. So if you have progesterone receptor positive breast cancer, the synthetic progestins are a real problem for that. And it upregulates the progesterone receptors on the cells, just like in breast cancer that are progesterone receptor positive. So if you didn't see last night's, I think I don't have it reposted just yet, but you'll want to go back and watch that. Okay, so what are the answers besides hysterectomy that they do for medications? So you can take ibuprofen, antibiotics, fibrinolytics like tranexamic acid that actually prevents the breakdown of blood clots, danazol, which is an androgen, pain management, oral contraceptives, Lupron, which actually kicks down that feedback loop from the brain. This is bad stuff. This is like instant menopause. And then actually, I have a patient, this is interesting, that we do lidocaine injections. Basically, we just do like 5 cc's of lidocaine into the pelvic wall. And amazingly, she'll get relief for like 3 months. So that's something you might ask your doctor for. And then natural would be bioidentical hormones, of course, mostly bioidentical progesterone. Fish oil, because that helps the substrate to make your natural progesterone. Vitamin D, because it regulates your estrogen and progesterone. Turmeric can help with inflammation. You've probably heard of black cohosh, evening primrose oil, DIM, which is diethylmendolamine, which helps block your estrone. Probiotics and maca root can help as well. So I want to just kind of leave with a little bit more nerdy inflammation. Gosh, I have brain fog from all the mucus in my head, I think. That some of the myths that come from HRT or hormone replacement therapy, even bioidentical hormone replacement therapy, that your doctors are getting confused about, that people get confused about. And your doctors are seeing 60 patients a day, so they don't really have the time to really sort through all this. But the myth of HRT comes from long-term use of birth control, which is synthetic hormones, like synthetic estrogens and synthetic progesterones called progestins. And you can imagine if you are on long-term synthetic hormones, the risk of everything goes up. Blood clots, because the production of clotting factors through the liver, you're taking an oral pill that's going through the liver. And somebody mentioned factor V laden. That is actually a clotting disorder. And if you have the genetic predisposition to clotting problems or bleeding out problems, and you're taking synthetic oral progesterone or estrogen, that absolutely can increase your risk of clots. If you are a smoker, that increases your risk. Obesity, high blood pressure, and a history of surgery, or if you're laying flat where the blood's not moving around. Excuse me. I probably need that right now, a drink. So so synthetic hormones are very different. So bioidentical progesterone cycled, some of these supplements, and having the answers, the solutions, and not just taking what they say. Now, if you have uterine cancer or something, that's completely different. And the person who mentioned they're having a hysterectomy, it wouldn't be the worst thing ever to just explore some of this and to find someone who might have some answers besides just taking the uterus out. So I'm not telling you not to have it. You've scheduled it, pre-opt for it, but maybe this was like you were meant to be here to hear this message. Maybe that was God's way of saying that might not be the only option for you. Or if you know someone getting ready to consider hysterectomy, maybe that's time that you say, hey, go watch this crazy lady on TikTok every night at 7:00, because that's not your only option. But they present it like it is. And with 600,000 of these hysterectomies being done a year, and it's crazy because they say, oh, let's just take the ovaries out because you could get cancer in them. What the heck? I mean, how is that even a thing? You want to go ahead and take my pancreas out because I might get cancer in that. Oh, why don't you go ahead and take my gallbladder and my appendix? Oh, why don't you just take the whole intestines out? Oh, my bladder too, because I could get bladder cancer. I mean, it is just madness. And I totally understand that you still need to go through the medical system, but you don't have to go in there blindly, and you can totally know some of this information, and it could save your life. Turmeric, ginger plus black pepper taking every morning. Yeah, absolutely. Oh, another real crazy thing is Tums. Tums can actually help for pelvic cramps if you're having really bad cramping too. But when I put people on natural bioidentical progesterone, days 11 through 21 of their cycle, if you're perimenopause and you're all over the place, then we just go right for bioidentical hormone therapy. But absolutely. Whatever problem you're having, you might just want to consider us. So how we start is we do a hormone test kit, and this comes with a questionnaire. So all the problems, bleeding, irregular bleeding, heavy bleeding, fibroids, endometriosis, anything that you've had, you tell us. If you're on any kind of hormone therapy right now, you tell us. And then all you do is you put some saliva into this tube. Saliva testing is very, very well tested. This company's been around that we use for over 40 years, almost 50 years. Very accurate. I am able to see where people fall on their levels and actually able to match their dosing because, or for a friend, oh yeah, that was my fiance. He's my moderator. So we can actually look at your levels, and then we can tell you how much you need of whatever it is, estrogen, progesterone, even testosterone. Testosterone is very powerful. Women are told they don't need testosterone. Women actually make more testosterone than estrogen. I know men make a lot more testosterone, but apples to apples, we have more testosterone until we start having problems or until we go through menopause. So even if you are scared, then you can still take testosterone, but go back and watch my other videos and you won't be scared of estrogen anymore. Hard time with link to do to take sent to my email. Okay, so we are working. We've had a few little glitches on our email links. So we are working on everybody, I promise, because we do have a little bit of glitching going on with our system, with our emails, but we won't forget anybody. We're reaching out, and if anybody's having troubles. If you have trouble, you can always direct message me on TikTok. Hopefully this stays. If not, direct message me on Facebook, or you can email me at drtammy@hormonebliss.com anytime. And our company email is info@hormonebliss.com. But feel free to reach out to me. Absolutely. I want to know if there are any challenges or anything. So yeah, so you just do your saliva sample. The shipping is free. The shipping to the lab is free, and the consult with our hormone coaches is included. So start with that. Just know what your levels are. I mean, it was like if you didn't have a thyroid, wouldn't you just want to know what your thyroid levels are? So don't you want to know what the hormones are that actually make your uterus and your ovaries run? That seems like that's super important. So, and yes, and then the goal is when our coaches talk to you, they can look at your levels, look at your symptoms, and then recommend, do you need cycled progesterone, or are you in perimenopause? Do you need estrogen, progesterone, and testosterone? Are you postmenopausal and ovarian failure? What do you need there? And you can actually get your life back, stop suffering, stop these heavy periods. I have worked with women for almost 25 years as a medical doctor, and I have seen women go from terrible, terrible endometriosis, fibroids, to very pleasant light periods that last 3 days that become very regular and can even get pregnant if that's what they want. Then we have to do some family planning if that's not what they want. But I promise you, I have seen it so many times, and it is so doable. And so if you are looking at something like a hysterectomy, and if it's not cancer and you're not like so anemic that you're like really, really sick and they have a really good reason for it, I understand, because I was there. Because at some point I had my uterus out because it was really, really bad. And I wish I'd known then, but hey, it is what it is. I am here now. And I've learned a lot about bioidentical hormones. Looking back, I would not have had it done. That was 20 years ago. But yeah, it doesn't have to be that way. So gained 21 or 20 pounds. Yeah, I had terrible weight gain. I've got a lot of videos on weight gain. If you go to my link in bio, I have some free downloads. There's one on weight loss, and I have a ton of information. I'm actually in the final editing stages of my new book called The Menopause Metabolism Reset. I have so much information in there, but in a nutshell, the thyroid competes with estrogen, and you can have thyroid dysfunction. Dangerous. Is DNC dangerous? Okay, Constantine, I'll come right back. And I know I'm up on my time for my hour, and I probably need to go drink some tea and rest. But anyway, that's important. What was I saying? I really am having some brain fog tonight. But yeah, so I mean, there's so many solutions. Just don't settle for that. But you asked me about is ablation and DNC. DNC is basically where it's called dilation, where they dilate this out, and curettage means they just scrape the lining out. So yeah, I mean, dangerous as far as 20 pounds. Dangerous as far as anytime you go scraping internal tissues. Yeah, that's potentially dangerous. Ablation, they put you to sleep, so it's anesthesia, which has risk. And then cooking the inside of your uterus, absolutely. Yes, and I do have a YouTube channel, Dr. Tammy Tucker, thyroid and estrogen. Oh, yeah. Okay, so when your thyroid's gone, your metabolism's gone, and natural estrogen actually stimulates the GLPs, which are kind of like the weight loss shots, the Ozempic and Mounjaro and things like that. Estrogen stimulates GLP. So if you don't have the stimulation of GLP, you're going to be hungry, you're going to crave sweets, you're going to have insulin resistance. So there's so many connections with weight gain. And the main thing that's in my Menopause Metabolism Reset book is the relationship of liver and how all the hormones get converted through the liver and how you can take care of your liver. So liver health is very important. So Tacoma, I hope you have your dandelion tea. And I'm going to go have some tea now. I love you guys very, very much. Thank you for being here every night. If this platform does go away, please know I love you, and please find me on the other platforms. And y'all are just beautiful, and there are women suffering. So please share this information with them and have them follow you wherever I go. And I hope I'll be here tomorrow night at 7. Okay, I love you, and I'll see you later. Mwah.